Welcome everyone to tonight's webinar using digital health technology in the COVID environment. Obviously hosted by Northwestern Melbourne PHN. Before we get started, I just wanted to do a quick acknowledgement of country. Northwestern Melbourne Primary Health Network would like to acknowledge the peoples of the Kulin Nation as the traditional custodians of the land on which we're meeting today. And we recognize their continuing connection to the land, waters, and culture, and would like to pay our respects to elders past, present, and emerging. By the way, something that I forgot to do as well, my name is Nick, and I am one of the, people in the digital health team here at Northwestern Melbourne Primary Health Network. Just a little bit of housekeeping. We're going to keep everyone on mute. In terms of questions, definitely use the question box on the side of your screen. There'll be a little questions box, and then myself, I'll be monitoring that, and we'll be asking Katrina those questions as well. In terms of this presentation, it will be filmed, and any questions that you have, it'll remain anonymous in terms of your identity, that is, to protect your privacy. So today's speaker, the person that you've been looking forward to is, my laptop just went a little crazy. Technology. Let me deal with that. Okay. Katrina Otto from Train IT Medical. I think most of you would have heard about Katrina, seen one of her webinars. We've definitely had Katrina over for countless times, actually. And she's one of Australia's most experienced digital health and medical software trainers. She's worked in a wide variety of medical practices for the last 30-odd years. At many of those as a practice manager. She has qualifications in adult education, business and welfare, works across Australia as a medical software trainer and practice management consultant. So I think it's safe to say she definitely knows what she's talking about. So without further ado, I want to hand it over to none other than Katrina Otto.
Thank you so much, Nick, and thank you, Northwestern Melbourne Primary Health Network, for inviting me back. It is an absolute honour to be with you all, and I wanted to also let you know this presentation will be emailed to you very soon from the PHN, and the PDF of the presentation I refer to tonight will be sent to you also. And I like to share those because what I tend to do is I put links in them. So if you can download it in PDF format, click on the links if this is something that you would like to know more about. So a good example here is I'm looking at the Australian Digital Health Agency recommended training checklist. And this is a good guide because training is really important for your staff when it comes to digital health. There is a legislation, there's a lot of compliance requirements around it. It's extremely helpful and important tool for us these days. So there's also a wealth of training information provided. And some of these, the clinical software summary sheets, I created these. I was a contract trainer for the Digital Health Agency for 3 years. So access those, they're all free. They're all for you. Tonight, I'd like to not only talk about my health record, but talk about all of this new technology that we've been given in these crazy COVID times. National Health Service Directory, Health Direct. There's so many acronyms, so many technology options for us. I'm going to try and break down the choices a little bit for you, and please type in your questions. If I don't know the answer, I promise you I'll find out and follow up. I want to talk about using my health record as the most efficient way to access your patient's vaccine status. And we've got some exciting new information in that regard to share tonight. Also extremely handy to access Medicare details. I'll quickly show you how you can access and upload health summaries, and we'll talk about, why this is a really important thing to do in our digital practice of the future for continuity of care. And also some of the tips and tricks, advanced features, everything that we're doing hopefully is also leading to not only sustainable practices of the future, but, high performing and hopefully happier practices of the future if we can combine good use of technology with engagement. Some of the technology that I'll be talking about tonight is really going to help with that. And I'll touch on data dashboards. I love data dashboards. So PenCS, I'll talk about Cubico a little bit. These products are designed to help us with our practice management. First of all, starting off, the National Health Services Directory, so vital that you practice. I'm sure it is registered with the National Health Services Directory. And send me a note in the questions who is actually delivering vaccines at the moment. If you're actually doing COVID vaccinations, let me know. Of course, this link here takes you to the National Health Services Directory. Your patients go to the vaccine eligibility checker and assess where they are with the eligibility criteria for the vaccines and where to go. Thank you for sending me your yes. I've been doing a lot of COVID vaccine webinars with my fabulous nursing team. Please send me a message if you would like to watch any of those. I'll send you a link. Especially in regard to what's successful from what we've seen so far, tips. The vaccine eligibility checker, of course, updated all the time as new information seems to be so regularly released. I just also popped up there a statistic from Health Direct and the ADHA saying that 84% of our patients go online first for their health information. So, data is powerful, and that certainly tells me as a practice manager, I need to have a very strong online presence. And what I've seen with COVID is a presence with social media like never before, because we're able to tell patients where we're up to, what we know, and it's important to tell them what we don't know. Take them on the journey with you. We want our patients engaging with us for high quality information and preparing them for your changes with your technology too. Now, when we talk about technology in relation to COVID vaccines, of course, checking the vaccine status is number one. This is my wonderful trainer, Train IT Medical Senior Trainer Sue Cummins, getting her COVID vaccine. She was working at Redfern Aboriginal Medical Service, helping with their clinic, and kindly allowed me to use her photo. And of course, accessing that vaccine status is able to be done in numerous ways. Accessing the AIR, Australian Immunisation Register, for that information in numerous ways. One of the ways that we access is, of course, PRODA. So pretty much every practice now should have a PRODA account. So this is our way of the future, an online identity verification and authentication system. So this is sort of essential now that we have access to PRODA. Through PRODA, we can access government services. It's a secure way we can access government services like HPOS, Health Provider Online Service. And of course, that tells us our Medicare information. It also tells us the AIR information. So that if you haven't already, absolutely do that. You will record those vaccine details within your software. And that's something else you could tell me in the chat. Let me know what practice software you use. Practice management software, often called Clinical Information System, CIS, one of our many acronyms. This is an example of medical director and best practice, entering the vaccine information into your software. It then will be sent through your software to the Australian Immunisation Register. This means your patient details absolutely have to be spot on correct. So one of the other tools we have for that, of course, is an online patient verification within our software. Now, this is a picture from Praxoft and with an example from COVID vaccines. One of the keys to success is ensuring that you are doing your online patient verification. Absolutely essential. We cannot send to the AIR if that fails. Praxoft is in my picture here because if you have one that fails, it could potentially hold up the whole batch. Okay, so just this is an example of a change. I was doing a online workshop on change management today. So it's an example of when change needs to just be embedded in your routine. So this is something that the front desk staff should just be doing for every single patient, validating. In best practice, you can do a bulk verification, and you're all telling me that you're using medical director in best practice. So let me know if you were using something different. I don't want to exclude anyone. So from the appointment book, utilities, do a bulk patient verification, and that will check a whole day's worth of patients for their Medicare, ensure that that is it's matched correctly. So that identification by these unique numbers is really important in a digital world. The bulk health identifier lookup is what's going to enable successful connection, one of the aspects that will enable successful connection with my health record. So in Praxoft, Medical Director, that's an automatic process, so you don't have to do a separate lookup. In best practice, you do, and you can do that individually, or you can do it for your whole appointment day at once in the appointment book. So a couple of little tips there, so that your vaccine information is successfully transmitted. And one of the things I've noticed since starting training with the COVID vaccines is, you know, people will say to me, we sent it, it's not there, I can't see the status on my own my health record, or it's not yet showing. And I always look for variables. Why? What could have happened? Is this a glitch? Is this a user error? We have 24 hours to upload. Save the batch numbers in your practice management software. That's a little tip, save time. We need to do a software to the AIR reconciliation. Now that's exactly what I'm talking about. You enter 25 vaccinations into your VP or MD. That's how many should go to the AIR. If it doesn't, why not? Sue shared an example the other day where the doctor had forgotten to tick not given here when entering that vaccine information. So there are little user errors. So we do a reconciliation. We can upload for patients without Medicare numbers, and I've just put the instructions for that recently. It is important that everybody's vaccine status information is shared. And for that, you would do a manual upload. It's not going to go through your practice software. So PRODA, HPOS, AIR. Now I love to share new things in my webinar. So you're the first I'm sharing this with, and that is that best practice, and there's a link to their article, has allowed me to share the fact that you will be able to access the AIR directly through best practice, coming soon. When it's a technical specification like this, medical director, other software vendors will follow suit. So this is, and there's a link, you can read that. Medicare Web Services is a really big change from a technical build perspective, not from a user perspective. What you all need to do, like hopefully already doing this, is ensure that you are keeping your software updates up to date. So you're keeping your software up to date when there's a new upgrade, and keeping your eye on the information from your vendors. So for practices that do not have conformance software like Medical Director and Best Practice, there is a new platform that can, and tell me in the chat if this is anybody listening, if you don't have one of the general practice software that's conformant, like Medical Director, Best Practice, Genie, ZMed. If you don't, perhaps you're an allied health professional and your software is not conformant, you could still upload information via this CVIP, Clinician Vaccine Integrated Program, and there's a link there. Okay, but I just wanted to be really clear. This is not for you if you work in general practice with conformance software. Now, with technology changes that have taken place since COVID, one of those was online appointments, the need for online appointments with more flexibility, such as telehealth appointments, the need for online, basically paperless or non-attendance. So we didn't want anyone to touch anything, so therefore having registration, online registration forms is a real efficiency improvement. People not filling in pieces of paper, not touching pens, sometimes not even coming into the practice, of course. And I'm well aware the area that I'm training in tonight, so you know more than anyone, we needed to have technology that supported telehealth, that supported online registration forms. So our vendors, amazingly, have worked so hard and given us a whole lot of wonderful options. Now, I can't mention everyone, but I like to be fair. So here's a selection, usually just based on how much their pictures look good on my slides, but HotDoc, AutoMed, HealthSite, 3 fabulous online booking providers who have created even more features in these COVID times, such as new patient registration forms, such as vaccine management features. So have a look at those if you're not already. And one of the aspects that I've been particularly fascinated with, and I have to say, I work with a lot of high performing practices, so they're very, we're always looking for what's new, what's progressive, what's going to save time, money. Better Consult, I was very impressed with before COVID. I got a lot of resistance to it before COVID. However, what seemed to be a barrier before is now seen as efficiency, thankfully. So having information before your patient presents is a time saver. So have a look at that. HealthShare is a great company. They also provide your online patient education that's within your best practice and medical director. It's free. This is free. It comes with your software. So it's worth a try. You can set questions and patients can answer those questions. And then you decide if you want to save the patient's responses into your progress notes in your software. So you have more information before the patient presents. Hopefully that will help with your consultation. Of course, online booking platforms offer various features. Health Engine is well known for offering the feature for practices who are really particularly interested in new patients. So it's that online presence, and in particular, and they, of course, hit the media because they won the contract to build the COVID vaccination booking system. Now, that was the booking system for people who don't already have HotDoc or HealthSite or AutoMed. They don't have one at all. This was an option. Health Engine also built new features for practices in relation to the vaccine rollout. So there's some more information there to have a read about that as well. AutoMed, this is Denise from one of my wonderful clients. We're an Aboriginal Corp at Port Macquarie with her brand new, she's a nurse practitioner, her brand new vaccination fridge. And AutoMed is an example of a technology, health IT, that has been designed to help us with our stock control. So this may be of interest to you as well. Have a look at that. And allocating appointment types. So there's a lot of really progressive features in this technology field that we're in that enables us to streamline our systems. And that's the difference between an efficient practice or COVID vaccine clinic in particular, and one that will struggle if there's a lot of extra work to do. Now, My Health Record is the fastest way to access vaccine status for your patients at the moment. There are a few tricks to know, so that's why I'm really pleased to have this opportunity tonight to just have a look at it and show you. And I'm hoping to get time to show you on the on-demand training environment. I've also put slides in the presentation, so should that not work or run out of time, you still have the steps. Just put in the GoToWebinar side panel for me. How many people are routinely accessing and uploading information to My Health Record? What I've found, and now I've been to My Health Record since day one, I think, pretty much, since it was a concept, long before it was integrated into MD and BP. So this has been a long path, a long build. It's improved a lot over the years, and it is a national online summary of health information that is available to all Australians and clinicians for free. So My Health Record contains information from the Australian Immunisation Register. It just flows in there automatically. The MBS and the PBS flows in there automatically. Nobody has to upload those separately. When you do a script or when you bill in your software or you do an immunisation and you send that to Medicare, to the AIR, it also flows into patients' My Health Record. So it may be time to have a look at My Health Record again, if it's been a while, to see if there's some value that you can get for your practice from it. Okay, I am often seeing people do a whole lot of work, and I say, you could just go on My Health Record and click save instead of ringing, chasing, faxing, scanning, or going without. So it's worth having another look now that there's been so much progress over the years. And that's an example in this patient record, being able to see that they've had their COVID vaccine, and you could then just click save, and you have documentation in your software, you have evidence in your software that you looked at that and that's what you based your decision on that day. Okay, now this is never going to be 100% accurate. It's never going to be a complete record. It's going to be a summary of information that should be helpful to you. I wanted to
Katrina?
Oh, yes.
Yes, I just thought I'd jump in. I can see a couple, two people saying they haven't actually used the My Health access the AIR through the My Health Record yet. And then one of the questions that popped up just in regards to this was, Katrina, if we practice managers don't have an IHI-P, so I think this person's referring to like a practice HPIO number or a HPII number. This person says, I didn't think we could access the My Health Record. So Katrina, maybe you could expand on, for those people who don't have the right software products, or if they don't have the right codes, if you will, how would they gain access to the My Health Record?
So this is the first thing to know is that the My Health record, like the medical record here that we're looking at, is for clinicians. So nurses running vaccine clinics at the moment. From an admin perspective, what we do, practice management perspective, what we do is we facilitate the medical record set up so that it works when the clinicians click on that button. Similarly, in a practice, an admin person would be the one who is entering, of course, all the demographics, and they are doing the online patient verification. They're not going to be the one accessing clinical information like, has this person had their vaccine elsewhere, through the My Health record. They may facilitate the success of access to My Health record. So what I might do is I'll show you how you can access this quickly, and then I'll come back to some of the questions related to sending immunisation information from medical director or best practice to the AIR. When you're entering the immunisation information in the software, such as we can see here, the immunisations in BP, that would then go through best practice via the management module. If you're doing it in medical director, it would then go to the AIR through Praxsoft. Okay, so it goes nicely, seamlessly over to Praxsoft, and it goes over to the AIR via the Medicare claiming module. Okay, so that process absolutely will give you the cheat sheet to do that. It is super easy, and it is something that hopefully will be just done every single day. It's probably what most people who are doing vaccinations for children would be doing it regularly now, possibly not every day. Now here is a cheat sheet and a link for those cheat sheets to access immunisation information via medical director and via best practice. And the reason I particularly wanted to ensure that you get these cheat sheets is because there is a new document within My Health record built, because the feedback was it was tricky to find it. If you think about, as I said, with HPOS, we've got all the Medicare documents. With the AIR, we've got all the immunisation documents. We've got all the medications. That's a lot of information for some patients. So sifting through all those, one of the things that's helped with that are these filters. In order to see the information, we need to make sure that we're not filtering out information. Okay, so this is what it looks like in best practice when you click on the My Health record button. If you have that box ticked to exclude Medicare documents, you will not see them on your list. And as I said, prior to now, and maybe now in your software right the minute, everything's grouped into that Medicare overview. Okay, so filters, this is medical director, these filters are really, has been what stopped people being able to see My Health record immunizations on their My Health record. What the Digital Health Agency have done for us is created a brand new document to help with immunization data, because it's never been that vital before that we need to quickly see patients' vaccine status. And now we do, and we're going to need to do it all the time. So they created a brand new document. It's called Immunization Consolidated View. It works, and you can access that from the patient's My Health record, and there it is there. So it will look like that. And you simply save it. And that's your documentation that you checked the patient's vaccine status and you saved a record if you want to save it. So that is a new feature. And there's the steps. You select My Health Record, select the document filter, and you scroll to Immunisation Consolidate View. It saves it into your medical director. Something else that may interest you, I'll go to medical director if you like and show you. Something that may interest you is when you look at this document at the top of the page, it's also showing the National Immunisation Program. Okay, so it's saying that that NIP is up to date. Their COVID vaccination status is not up to date. Their next vaccination is due, or was due. So this is technology like we've never had before and what we need right now. So this is available now because those screenshots I used were from my trainer Michelle's practice this week. So I will keep going, but if time permits, I'll go to the software and show you. I'm just aware that you all use different software. So we'll have a quick look at accessing and uploading. And from best practice, we go to My Health Record. So this is how easy it is. We go to My Health Record, create shared health summary, preview, upload. So now if you're not a clinician listening tonight, no, you wouldn't be the one doing this because you do need to be a clinician. You do need to be providing healthcare for your patient. So there's strict rules and penalties around use of My Health Record, and I would encourage everyone to go to the Australian Digital Health Agency and do the training. There is multiple methods of training created for ADHA. Important to learn all the compliance aspects, but from a usability aspect, it's dead easy. My Health Record, create shared health summary, preview, and upload. Now, of course, I'd like to think that it's that easy for everyone because your data is just up to date, and it really, I guess, does highlight the importance of curating your patient's health summary and maintaining the integrity of that. That is the era that we're in. In your e-learning that I'm giving you, we're talking about this is essential clinical data now. So if you haven't got your data entered and updated, definitely factor that in. Use this for your EPIP and your PIP-QI activities. We want to make this streamlined process. And the doctors that I see who don't have trouble with this, they routinely update this information for their patients. So it is something that we need to do: medications, allergies, past history, and immunizations, because it's a sharing, caring, coordinated care era. We're not the only ones accessing our patients' information. Other clinicians and patients themselves. So medical director, now you can do this two ways in medical director. I'm showing you from the letter writer. So F8, there's your little medical director tip. F8, eHealth, shared health summary. And then the little colorful My Health Record icon. So I would challenge anyone who says it takes a long time to upload a shared health summary. I would say for some it takes time to clean up the information so that it is fast to upload. But I would say that that is an expectation, and for your sustainability of your practice, for your risk management, that is something. Allergies, medications, past history, immunizations, at the very least, not that that even goes anywhere near meeting our requirements for accreditation or high quality care, but at the very least, allergies, immunizations, past history, medications, we need to have that information up to date. Should our patients need to go to hospital or see another provider, and they need to access that to provide care for them. So eHealth, there are options for when you look at the preview to quickly click on the little box with 3 dots to quickly curate that and update it. So you can ensure that you're uploading information that's as accurate as possible to your knowledge. I always say to everyone, do it with the patient, because they are going to be the ones that will sometimes tell you, oh, actually, I did have another allergic reaction. Haven't seen you since then. Or I stopped taking that medication because, you know, it made me feel ill. Then you could add an adverse reaction. And again, that's information that will go with the patient. It is a conversation, and I know that takes time, but some of these conversations save time with complaints later on. And one of the goals of and one of the keys to a successful practice of the future is patient involvement in their own healthcare and their own health information and sharing. So let's do that in the most efficient way. And let's maximize practice incentive payments. Why will we do that? Because profitability, sustainability, and efficiency. So we talked about the filters. We talked about quality improvement activities, and as in EPIP and PIP-QI. And I won't go into a whole lot because, as I said, you've got the e-learning courses which do cover a lot of this information that I am talking about briefly tonight. One of the key features of this is that you may focus your quality improvement activities on areas which meets the need of your practice population. Now, that has never been more clear than right now. Our practice population needs us to be providing COVID vaccines. They need us to be providing flexible care options. They need to be able to do things like use electronic prescriptions for telehealth. So there are so many improvements that we are doing, could be doing, and all the data improvements that relate to those. There isn't anybody who should not be easily meeting EPIP and PIP-QI. And please, if you are having challenges with that, reach out, contact us, because you know, you have changed champions. My goodness, all the change you've had to cope with in the last year. One of the key things is let's make sure that we can use data to see care gaps, to fill those gaps and ensure we're billing appropriately as we go along. That digital health umbrella term, you know, we saw how we can move fast when change can happen, when the risk of not changing becomes greater, right? And that's what happened with telehealth. We had to move fast because we couldn't see our patients. So we can move fast and we can adopt technology if it is needed. So let's set all of this up step by step for improved use, and that will then set your practice up for continued sustainability, because patients will engage with you. One of my challenges is I'm a carer for my elderly mother, and my health record is very helpful for carers because we're facilitating care for multiple healthcare providers. So having that key information up to date is really helpful. One of the key things that is frustrating, of course, is not everybody is using it. So this is a good example of a quality improvement activity. What is the next step? Most of your patients have a My Health record. Have another look at it with your team. Make that part of your quality improvement activity. Quality improvement activities, literally, I say, even this post-it note is too big. Use a small post-it. I go, don't make them complicated. Write down your ideas, try them. Was that change an improvement? Nobody was using My Health record before. Now we've got 2 people using My Health record. Was that helpful? Did it save having to chase medication information because you could access that medication view? or that discharge summary. And one of the key improvements with my health record I saw over the years, based on feedback, was a medication view that summarized what had been prescribed and dispensed everywhere in one view. So if the hospital had dispensed it, the pharmacy had dispensed it, it was one view. Doctors have given fabulous feedback over the years, and they've gone and into enhancements. The vendors get the enhancement specifications and build it for us. Another key advance over the last couple of years has been pathology and radiology. And again, I would put a suggestion for your quality improvement activities. Engage with your patients. Have a conversation about results. They can access their own results now in My Health Record. So there's the medicines view. So have a conversation around this. Could this be more helpful to your practice? What I would do is say, well, how much time are you spending chasing information? What information are you chasing? What are you faxing? What are you scanning? How could this be streamlined and improved? A little tip from my wonderful trainer, Michelle, today was not all COVID results are coming into My Health Record. So what she's doing for her patients is she's uploading their COVID results via an event summary. Okay, so this is an additional feature, which means they can access those results everywhere they go. So in an ideal world, every COVID test result automatically goes to My Health Record, like those ones. But we live in the real world. I don't know about you, I don't have a perfect system. Now, little tip with Medical Director, I thought I'd share with you some advanced tips. These filters, and this works across different areas of Medical Director, so the correspondence section and so on. Use these filters, they're fabulous. But if you like the views, for example, if you set this, I want to see every document just for the last 3 months or the last 12 months, whatever you choose. Right click and then save those preferred filters. Okay, discharge summaries. People still don't realize how many discharge summaries, all our public hospitals, the discharge summaries go to My Health Record. So this is something to remind your team about. I'll also pop in here that you can access this via the portal. However, I think you've pretty much all told me you have conformance software, so you wouldn't need to do this. And of course, patients can access their own results. That's the era we live in. My suggestion is to teach them how they can easily do that via an app. This is me and my beautiful mother that I care for. She was in lockdown, it was terrible, and we would do FaceTime. So this is me saying to the doctors with telehealth, use what patients know, what they're familiar with, but how important it is to be able to see your patients. Okay, you can tell a lot by seeing, and you'll never get that smile's for me. But what she wanted was to be able to see her doctor, see anybody for a while there, but see her doctor. So she loves her doctor. So these are 2 apps that you can use for patients to access My Health Record, and I use Healthy. I am a authorized person, so I can access my mum's information via an app on my phone. Okay. So I'll come back to some of these software specific questions, if you like, in a moment, but I just wanted to build on what I was mentioning before about smart technology, practice sustainability. How can we use data to improve our practices and improve our healthcare provision? Pen, tell me in the chat if you use Pen and or Top Bar. Data dashboards, wow, how good. So here we're able to see our population, the immunizations, And of course, we can filter type of vaccine, COVID-19, whether adults, children, whether age ranges, and so on. This is Cubico. Yes, you did, thank you. So you're already using pen, which is fabulous. And all of these products are just bringing out helpful features for us all the time. So this is Cubico with their vaccination cabinet. They have over 100 metrics in the program, but this is their vaccination cabinet. And it allows you to see right now who meets the criteria for this phase that we're in. Oh, who's in the waiting room that might be eligible because I have a dose left and it's getting towards the end of the day. So proactive management and also, you know, reactive management with a visual, easy visual based on their data. So that brings me to the end of my presentation and allows me to demonstrate and answer some of your questions you have that are a little bit more software specific. So please keep typing those in. And I'd also just like to point out that on my general website, trainitmedical.com.au, I have a COVID-19 free resources page. So that's updated regularly with resources that I've collated that I feel might help you. It's like my filing cabinet when I'm traveling around. And I also share on social media. I wanted to also mention Health Pathways, your PHN online resource. And they, I find Health Pathways gets rave reviews from the people I'm training, you know, appropriate contextualized information that you need at that point in time. Now, before I hand over to Nick to say the final farewell, I wanted to take you to, let me just see if I can get out of the presentation. So I wanted to take you to the Digital Health Agency on-demand training page. So digitalhealth.gov.au, there is so much information here for you. And what I wanted to show you, this is really important. Now, this is being updated right at the moment, but there is a My Health Records software simulator on-demand training where you can go in and you can play with these features. Now, I can go into my medical director, for example, and I can go to show you how easy it is. I can go to the letter writer, I can go to eHealth, I can go to shared health summary, and I can go, see, that's how you do it. And then I could go, and then you click on upload. So out again, I could go, I'm going to do an event summary. Click on my health record, eHealth, I want to do an event summary. An event summary, of course, will import your progress notes from today. Fabulous, because it's about today's event. And as I mentioned, one of the tips was if you have had a COVID test in your consultation today, then that would also be included. If you've done a COVID vaccine today. Now, of course, event summaries don't count towards the EPIP, but they're a really good tool for when we want to share more information than just the health summary. So while I can play a little bit in my software here with my dummy patient, and I can double click on the IHI there and I can show you where that information is. When you go to this on-demand training environment, you can actually access dummy software. You can actually access videos to watch it. And now we've got all sorts of other aspects, lots on cybersecurity since I last looked, and how to use it, online training. There is a lot of information. You go accessing immunization information in all different software. So know that there is a whole lot of information there for you. And if I look at your your questions relate to how do we send directly from software to the Australian Immunisation Register? If you're using Praxsoft, that would be with your online claiming. It simply goes over with your Medicare batches. What can stop it going over, as I mentioned, is if you haven't done your online patient verification to validate their Medicare details. I can't show you because I'm not live with Medicare. In best practice, we're going to be able to access our vaccination information. There's our e-referral, so I got distracted. And again, because I'm not live, it's limited to what I can show you in here, but you would send that through regularly every day. I would do at the moment. And Medicare details is the same place as we saw before. Just let me show you that slide. So the Medicare details in best practice or medical director, it's using our filters. Okay, so that's that slide. I'll just go back to that slide. Medicare information, use your filters here, and you're looking for Medicare overview. So that's how you find your MBS information. In best practice, it would be, we did have a slide here with that one. Here, untick exclude Medicare, and then you will see it on your list. So let me know if you have any further questions or if you have suggestions.
Katrina, there was one here. This person basically said, hello, my admin officer says that if she enters the date on Praxsoft Air along with the batch number, it does not go through. If she enters just the batch number, it goes through on the batch. I don't know if that's a question or just a remark, but I thought I'd just put it out there for now.
Yeah, so we enter the date as part of the yeah, so you would be in, was it medical director or best practice? I'll use MD. So we would enter the Praxsoft. Okay, so you'd be therefore you'd be doing that in medical director. So you'd be entering the immunization. Oh, COVID. So there it is, COVID, and on the left. So you'd be entering, and you'd be entering the batch number. The date is going to be entered automatically because it's the date that you're entering. You need to have today's date in there and save that. That, you don't do anything else from there. It then goes over to Praxsoft. So the next time you open Praxsoft, it'll say there are immunizations to import. Do you want to import them? You say yes, and then that goes to your Medicare online claiming section in Praxsoft, and then with a 0 value, and then you will send it over. Oops, sorry. You'll send it over with your claims to Medicare. So if you have any problems such as that, just contact Praxsoft. Both of the software vendors have fabulous help teams if something is not doing what it should. They often will send you a script to load if that's an anomaly. Sometimes things happen to just a few sites depending on infrastructure and other factors that are going on at the site. So other times there's known issues, and then those are fixed in upcoming releases. And that's something just to be aware of. When you get those upgrades from your vendors, they are often fixing little bugs. So always make sure that you do keep your software up to date. And a lot of people got stuck with that when e-prescribing came in because they had really outdated versions. And when we move towards Medicare Web Services in March next year, you won't be able to claim. So please, it'd be just absolute chaos. So please keep an eye on that and make sure you're reading what comes from your vendors and keeping up to date with the changes ahead as well, because there'll be good changes, easier access to government services that we're using all the time rather than going to log on to Proda is something I welcome.
Well, that was a really, really good, that was an amazing presentation, Katrina, I must say. Having had you do our electronic prescriptions one last year, yeah, I mean, amazing stuff. So thank you very much, as well as answering those questions. I'm sure everyone has definitely taken something from that. I certainly have, that's for sure, and I work in this space. Can you believe it? One last thing, just in regards to post-event, what's going to happen from here. Basically, the things that Katrina talked about, some of the additional resources, we will be sending that out. On top of that as well, we would love if you could fill in the post-event evaluation survey. That just gives us a little bit of feedback. On top of that, that also gives us an opportunity to, or gives you an opportunity to contact us if you need anything in the way of, My Health Record and all these different things. Myself, I work in the My Health Record electronic prescription space, helping different practices actually jump on board. And I mentioned, I saw that quite a number of people here weren't currently taking advantage of that free government provided thing, software, if you will. So I just wanted to say thank you very much to everyone for attending tonight. Thank you very much, Katrina, for making the time to speak tonight. It has been amazing. Other than that, everyone, have a great night, and I hope to see you soon.
Wonderful. Thank you so much, everyone. All the best and good night.
Good night.